What is EMPAVELI? Pegcetacoplan.
EMPAVELI is a prescription medicine used to treat adults with a disease called paroxysmal nocturnal hemoglobinuria, PNH. What is the most important information I should know about EMPAVELI?
EMPAVELI is a medicine that can affect your immune system and can lower the ability of your immune system to fight infections. EMPAVELI may increase your chance of getting serious and life-threatening meningococcal infections that may quickly become life-threatening and cause death if not recognized and treated early. EMPAVELI may also increase the risk of getting serious infections caused by certain bacteria such as Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B. Serious infections may quickly become life-threatening and cause death if not recognized and treated early. You must be vaccinated against these bacteria at least 2 weeks before your first dose of EMPAVELI if you have not already had these vaccines.
Being diagnosed with PNH was a huge shock, and it really changed the way I live my life. But since my diagnosis, I've been able to learn a lot and build up a great support system. So when my doctor suggested I switch my treatment to EMPAVELI, I wanted to know more. EMPAVELI has been a great option for me because it's a medication I can infuse on my own. But I was a little squeamish when it came to needles and wasn't sure if I'd be able to do it myself. My doctor understood that and talked with me about the training and resources I would have to help make EMPAVELI a part of my routine. It's why I'm here today, to show you how to infuse EMPAVELI step by step. Before we get started, make sure you read the instructions for use before you begin taking EMPAVELI and each time you get a refill. It's also important to remember that a doctor or qualified healthcare professional should show you or your caregiver the right way to infuse EMPAVELI before you take it for the first time. If you have any questions on how to administer EMPAVELI, you can always reach out to your doctor. All right, let's get started. EMPAVELI must be stored in the refrigerator in its original box. It may come in a carton of 8 or single vial cartons. When you're ready, remove a single carton from the box in your refrigerator. One carton contains 1 vial of medication. You'll need to leave the medication inside the single vial carton. The vial will need to warm up to room temperature for 30 minutes. It is important to never try to speed up the warming process in any way, or return the vial to the refrigerator after warming. Step 1. Getting your infusion ready. I like to prep and get my supplies together when my vial is warming up. When doing your infusions, you'll want to choose a space with a flat work surface in an area that is well lit, safe, and clean. I'm most comfortable on my couch, so that's where I usually do my infusions. It is recommended that your space be away from children and pets. Here's what you'll need: infusion pump and manufacturer's instructions, compatible syringe for your infusion pump, transfer needle or needleless transfer device, sometimes called a vial adapter, to draw up product from the vial, the infusion set, which varies according to device manufacturer instructions, infusion tubing, sharps container, alcohol wipes, gauze and tape, or transparent dressing. Always thoroughly clean the table or flat surface with an alcohol wipe. If you are using your infusion placemat, make sure you clean it with an alcohol wipe as well. Wash your hands with soap and water and then dry them. Now we're ready to move on to step 2, checking the vial and liquid. Once the vial reaches room temperature, which should take 30 minutes after removing the carton from the refrigerator, you can remove the vial from the carton. EMPAVELI is a liquid that should be clear, colorless, or slightly yellowish. If the liquid in your vial looks cloudy, contains particles, or is dark yellow, don't use it. You should not use any vial with a missing or damaged flip cap, or if the expiration date has passed. Contact Apellis Product Compliance to report any issues with your vial. If the vial is unusable, remove a new vial carton from the refrigerator. Remember, you must wait 30 minutes for the new vial carton to warm up to room temperature before repeating step 2. If you're ever worried about not having enough vials, your care coordinator can work with you to ensure that you always have enough medication. Okay, let's move on to step 3, where we prepare and fill the syringe. Remove the protective flip cap from the vial. The central portion of the gray rubber stopper should be exposed. At this point, you can throw the cap away. Use a new alcohol wipe to clean the stopper and then let the stopper dry. To fill the syringe with EMPAVELI, you will be given either a vial adapter or a transfer needle to draw up the medicine from the vial. Personally, I use a vial adapter, but I'll show you both methods in this video. If you're using a vial adapter, remove the top cover of the vial adapter package. Do not remove the vial adapter from the package. Attach the vial adapter to the vial. Use the blister pack to handle the vial adapter. Connect the vial adapter to the vial by pushing it vertically down onto the vial until the vial adapter snaps into place. Ensure the spike has penetrated the rubber stopper. Remove the blister pack from the vial adapter and discard. Do not touch the exposed end of the vial adapter. Pull back the plunger to fill the syringe with air, which should be about 20 milliliters. This air will make it easier for you to withdraw the medication from the vial into the syringe. Attach the syringe to the vial adapter by turning it clockwise. Turn the vial upside down and inject the air into the vial, which will then allow the drug to fill the syringe. Slowly pull the plunger to fill the syringe with all of the EMPAVELI liquid. Ensure all the drug is removed from the vial. Place the vial back onto the flat surface and remove the syringe from the vial adapter by turning counterclockwise. Some people use a transfer needle rather than an adapter to fill the syringe. If you're using a transfer needle, attach a sterile transfer needle to a sterile syringe. Pull back the plunger to the 20 milliliter mark to fill the syringe with air. This air will make it easier for you to withdraw the medication from the vial into the syringe. Push the air-filled syringe with the transfer needle attached through the center of the vial stopper. You want to make sure you don't create bubbles, so the tip of the transfer needle should not be in the solution. Gently push the air from the syringe into the vial. Turn the vial upside down and move the transfer needle tip into the solution. Slowly pull the plunger to the syringe with all of the EMPAVELI liquid. Remove the filled syringe and the transfer needle from the vial. You can remove the transfer needle by using one hand to slide the needle into the needle cap and scoop upwards until the needle is covered. Once the needle is covered, push the needle cap towards the syringe to fully attach it. Make sure you're doing this with just one hand so that you don't accidentally stick yourself with the needle. After the needle cap is fully attached, twist it off to remove the transfer needle and throw it away into a sharps container. Now we're ready for step 4, preparing the infusion pump and tubing. To prepare the infusion pump and tubing, follow the manufacturer's instructions that came with your device. There are a few steps you will have to follow to ensure your infusion pump and tubing are ready for infusion. Once you're done with that, it's time for step 5, preparing the infusion site or sites. EMPAVELI can be infused into your abdomen, thighs, hips, or the upper arm regions. If infusing into the abdomen, ensure that you pick a site at least 2 inches from the navel or belly button. Make sure you do not infuse EMPAVELI into areas where the skin is tender, bruised, red, or hard. You should avoid infusing into tattoos, scars, or stretch marks. Always remember to use different sites from the last time you infused EMPAVELI. If there are multiple infusion sites, select ones that are at least 3 inches apart from each other. It's important to rotate your infusion sites between each infusion. Last time I infused into my thigh, so today I'm going to choose my abdomen. Once you've chosen an area that is different from last time, clean the skin at each infusion site by rubbing a new alcohol wipe on your skin. Do this by starting at the center of the site and working outward in a circular motion, just like this. Then, let your skin dry completely. Now we're ready for step 6, inserting the infusion needles. When you're ready, pinch the skin between your thumb and forefinger where you intend to place the needle. Insert the needle into the skin. Next, if needed, apply gauze and tape or clear dressing over the infusion site to hold the needle in place. If you are using a second infusion site, repeat this process to prepare the second infusion site at least 3 inches apart from the first infusion site. So my second infusion site could go right about here. In step 7, we'll start the infusion. Follow the instructions that came with your device to start your infusion. You should start the infusion right after drawing EMPAVELI into the syringe. In step 8, we'll complete the infusion. Follow the manufacturer's instructions that came with your device to complete the infusion. I use this time to relax and watch some television. It's also a good time to catch up with friends over the phone. The typical infusion time is approximately 30 minutes if using 2 sites, or approximately 60 minutes if using 1 site. Before I started EMPAVELI, I enrolled in the Apellis Assist program and had conversations with my care coordinator through a specialty pharmacy called Panther Rare. I was able to order my supplies, medication, and choose a few comfort items, such as these socks. Just 2 more steps. For step 9, you'll simply want to record the infusion. When you finish the infusion, record your treatment as directed by your doctor. I use the My Infusion Tracker app to help keep my schedule organized. If you don't have the app, You also have the option of recording your treatment in the treatment journal. We're almost done. Step 10 is where we clean up. After the infusion is complete, remove the dressing and slowly remove the needles. Cover the infusion site with a new dressing. Remove the infusion set from the pump and throw it away into the sharps container. Make sure you clean and store the infusion pump according to the device manufacturer's instructions. Now for the last step. Step 11 is when you'll dispose of any used needles, syringes, and EMPAVELI tubing. Put any used needles, syringes, and EMPAVELI infusion tubing in an FDA-cleared sharps disposal container right after you're done with them. It's important that you do not throw these away in your household trash. If you do not have an FDA-cleared sharps disposal container, you can use a household container that is made of heavy-duty plastic, can be closed with a tight-fitting puncture-resistant lid, upright and stable during use, leak-resistant, properly labeled to warn of hazardous waste inside the container. When your sharps container is almost full, you will need to follow your community guidelines for the right way to dispose of it. There may be state or local laws about how you should throw away used needles and syringes. For more information about safe sharps disposal in your state, visit www.fda.gov/safe sharps disposal. Do not recycle your used sharps disposal container.
EMPAVELI, pegcetacoplan, is a prescription medicine used to treat adults with a disease called paroxysmal nocturnal hemoglobinuria, PNH. EMPAVELI can lower the ability of your immune system to fight infections. It may increase your chance of getting serious and life-threatening meningococcal infections and serious infections caused by certain bacteria such as Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B. These infections may quickly become life-threatening and cause death if not recognized and treated early.
You must be vaccinated against these bacteria at least 2 weeks before your first dose of EMPAVELI if you have not already had these vaccines. If your healthcare provider decides that urgent treatment with EMPAVELI is needed, you should receive the required vaccinations as soon as possible. And you should also receive 2 weeks of antibiotics with your vaccinations. If you have been vaccinated against these bacteria in the past, your healthcare provider will decide if you need additional vaccinations before starting EMPAVELI.
Vaccines reduce the risk of serious infections, but do not prevent all serious infections. Call your healthcare provider or get emergency medical care right away if you get any of these signs and symptoms of a serious infection. Fever with or without shivers or the chills, fever and a rash, shortness of breath, extreme pain or discomfort, headache with nausea or vomiting, high heart rate, headache and a fever, headache with a stiff neck or stiff back, confusion, muscle aches with flu-like symptoms, clammy skin, eyes sensitive to light. Your healthcare provider will give you a patient safety card about the risk of serious infections. Carry it with you at all times during treatment and for 2 months after your last EMPAVELI dose. It is important to show this card to any healthcare provider to help them diagnose and treat you quickly. EMPAVELI is only available through a program called the EMPAVELI Risk Evaluation and Mitigation Strategy, REMS. Before you can take EMPAVELI, your healthcare provider must counsel you about the risk of serious infections caused by certain bacteria, give you information about the symptoms of serious infections, give you a patient safety card about your risk of serious infections, and make sure that you are vaccinated. Do not take EMPAVELI if you are allergic to pegcetacoplan or any of the ingredients in EMPAVELI, have not been vaccinated against Streptococcus pneumoniae, Neisseria meningitidis, and Haemophilus influenza type B, unless your healthcare provider decides that urgent treatment with EMPAVELI is needed, have a serious infection caused by the previously mentioned bacteria. Before starting EMPAVELI, tell your healthcare provider if you have an infection or fever, are pregnant or plan to become pregnant. EMPAVELI may harm your unborn baby. Females who are able to become pregnant should have a pregnancy test before starting treatment and use an effective method of birth control during treatment with EMPAVELI and for 40 days after the last dose. Are breastfeeding or plan to breastfeed. You should not breastfeed during treatment with EMPAVELI and for 40 days after the last dose. Tell your healthcare provider about all the vaccines you receive and medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements, which could affect your treatment.
If you stop taking EMPAVELI, your healthcare provider will need to monitor you closely for at least 8 weeks after stopping EMPAVELI. Stopping treatment with EMPAVELI may cause a breakdown of red blood cells due to PNH. Allergic reactions can happen during your EMPAVELI infusion. Stop your EMPAVELI infusion and tell your healthcare provider or get emergency medical care right away if you get any of these symptoms during your EMPAVELI infusion. Chest pain, trouble breathing or shortness of breath, swelling of your face, tongue, or throat, feel faint or pass out.
The most common side effects of EMPAVELI are injection site reactions, infections, diarrhea, pain in the stomach, abdomen, respiratory tract infection, pain in the arms, hands, legs, or feet, low potassium in blood, tiredness, viral infection, cough, joint pain, dizziness, headache, and rash.
These are not all of the possible side effects of EMPAVELI. Be sure to tell your healthcare provider about any side effect that bothers you or that does not go away. For more information, ask your healthcare provider. So there you have it. After receiving the right training, I was able to learn how to self-infuse EMPAVELI and ended up feeling more comfortable with the process over time. But don't forget that you have the support of your healthcare provider, your care coordinator, and Apellis Care Educator. If you have any questions, please call 1-866-MY-APL-ASSIST or look at the instructions for use that came with your medication. Remember to always talk to your healthcare provider if you have any questions or concerns about treatment.